Welcome to News Now from the Belmont Journal. I'm your host, Mike Crowley. We are joined once again this week by Lisa Gibalerio of the Wayside Youth and Family Support Network and coordinator of the Belmont Wellness Coalition. And this week we're talking about the Youth Risk Behavior Survey. And for disclosure, this data has been presented to the school committee of which I am a member, and we are not discussing my opinions as part of this program. So Lisa, tell us about the Youth Risk Behavior Survey.
Absolutely. So this is a comprehensive survey that is administered every 2 years in Belmont, and it is administered to students in grades 7 through 12. The YRBS asks a wide range of questions to our students, Mike, trying to gauge their overall well-being, their health, their questions on nutrition, screen time, experiences around mental health and bullying, and questions about substance use. So it's a really comprehensive tool that has been around for about 30 years.
So Lisa, tell us what the data shows about substance use and attitudes among Belmont youth.
So interestingly enough, Mike, we saw the numbers trend down when we compare the 2019 YRBS to the 2021 YRBS. So it appeared that our students were using less substances. However, the caveat to that piece of data, while good news, right, is also that the test was given last spring and the kids had just spent a full year from the pandemic. So it's hard to say if the test had been given without the global pandemic, what those numbers would have shown. But, they did show a reduction in use. So as far as their attitudes, the survey asked questions about their perception of risk and harm, meaning how dangerous do they think certain substances are. What we learned, Mike, which is fairly consistent in other years and across Massachusetts, is that students think that vaping and alcohol are more dangerous than they do think that marijuana is. So basically, marijuana is perceived as more harmless compared to the other two. And what we note from the survey is that as the kids get older, as they get into the higher grades, 10, 11, and 12, their overall perception of marijuana, of the risk of marijuana, continues to decline. So they just, continue to think it's not that dangerous. And we know that this likely reflects some of the changes that society has undergone the last several years with regard to legalizing marijuana, with regard to the fact that shops that sell recreational marijuana are popping up all over Massachusetts, and in fact, could pop up in the not too distant future in Belmont.
Okay, Lisa, a number of mental health questions were asked as part of the survey. What do the responses tell us about mental health?
So while I said the good news was that our substance use numbers looked like they trended down, the more concerning news was around mental health numbers. And it looked like the amount of stress and depression and some other factors trended up based on the survey. So we saw that students reported experiencing a lot of stress. The rates of depression, definitely they were experiencing depression. And the thing that really caught our eye, Mike, was around the number of students considering suicide or having made a suicide plan or engaging in self-harm. These numbers seem to have ticked up.
So what do we know about contributing factors?
Well, we know that the pandemic was definitely a contributing factor. There's been a lot of data collected around the pandemic's impact on mental health. The social isolation alone, we could call a contributing factor. But we also looked at different multiple variants at the same time. And we know that students who are experiencing stress or bullying or spending an inordinate amount of time on social media, those students are vulnerable to feeling depressed. So Belmont, I will add, is not alone in seeing the mental health numbers tick up a bit. We saw this across Massachusetts. And again, 2019 did show stress levels among our students, but it was those suicide numbers that ticked up since 2019.
How about the kids who are most affected, Lisa? What do we know?
Well, we do have some information on that, and we know that kids who identify as genderqueer and females showed higher numbers. And also with regard to self-harm and having made a suicide plan, we saw that kids who identify as multiracial showed higher numbers.
Lisa, tell us what parents can do to provide more support for their kids.
That's an excellent question, and one that we have addressed here before, and will again, I presume. So basically, I encourage parents to definitely check in with your kids around mental health. Have conversations. The same way that you would talk to your children if they had a migraine, issues with chronic migraines, or issues with other medical things. Make mental health a priority as well. To not discuss mental health is to stigmatize it. So have conversations, ask how things are going at school. Ask specifically, is there anything that I as your parent can do to support you? Keep an eye on the amount of sleep they're getting. Try to encourage a solid 7, 8, 9 hours of sleep. I know that's really hard with teenagers, but try to encourage it. Keep an eye on their use of social media. Encourage them to take breaks. Model taking breaks yourself. Put your devices away. And if you think that their behavior has crossed over into more concerning, they're really withdrawn, they're quitting things that they had enjoyed, sports, activities, they're not hanging out with friends the way they had, then really encourage professional help. It's difficult now. They're certainly harder to get those appointments, but it's not impossible. Contact your pediatrician to see if they have a list of providers. Contact the insurance company, your health insurance company, to see if they have a list of providers. So there are things that parents can do to show support to their kids.
All right, Lisa, anything else?
Well, just that I want to let the community know that the YRBS data that we did present last week to the school committee is on the school district's website under public documents for the November 9th meeting. So you can go and look at the data yourself. And also that there are 2 more opportunities to participate in a data discussion. We will be meeting with the Belmont High School PTSO on the evening of Thursday, December 9th, to discuss this data. And again with the Chenery PTO on the evening of Wednesday, January 12th, to explore the data. So a couple more opportunities to take a look and gauge how the youth in Belmont are doing.
Thank you so much, Lisa. This is so important, and we will talk with you next time.
Thank you.